Welcome. I am Terry Tropin, and today I'll be describing diagnosis and procedure coding for substance use, abuse, and dependence. But first, let me start out with some information about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I also am an AHIMA-approved ICD-10 trainer. I taught health information technology at Montgomery College in Maryland for over 20 years. I've also written books on coding. These books are study guides that summarize the coding guidelines. My books include one on E&M coding, one on ICD-10-CM coding, and one on ICD-10-PCS coding. These are all available on Amazon and are updated every year or as needed, since sometimes they do updates in the middle of the year. Okay, so this is an overview of this presentation. Each of these will be discussed in detail. What are psychoactive substances? Where do you find these codes? What are some basic definitions used with these codes? What are some general guidelines? How do you code for alcohol? How do you code for drug-related? How do you code for nicotine? How do you code for inhalant? And then also some other diagnoses outside the mental health section that are used with these codes. And then how do you find these codes in the Alphabetic Index for CM? And also an overview of the ICD-10-PCS codes used for treatment of these conditions. Substance abuse, use, and dependence are referred to as use of psychoactive substances. So what are psychoactive substances? Well, the mind, they act on the mind. They affect behavior and may make a patient dependent if they use too much over a long period of time. So what are included in psychoactive substances? Legal or illegal drugs, alcohol, nicotine, and inhalants. Each of these are going to be discussed in this presentation. First, I'm going to talk about diagnosis codes. Where are they found? Well, they're found in these areas of the tabular list. Alcohol disorders are in F10, drug-related disorders F11 to F16. Since there's a lot of different drugs and types of drugs, it takes more than just one category. Nicotine dependence, F17, inhalant disorders, F18, and other psychoactive substances disorders. And these are all in the mental health section. So let's start with categories F10 to F19 substance use. What are some of the, how are the codes set up? Well, the codes in each category are divided into subcategories: use, abuse, and dependence. Now, these subcategories are further divided into including digits for uncomplicated, which we're going to define, in remission, with intoxication, and with withdrawal. Now, in remission means they're not currently using. With intoxication means the patient is drunk or high at the time of the encounter with the provider. With withdrawal means they've stopped using the drugs and they're having symptoms of withdrawal, and we'll talk about that a little more also. So let's talk about use, abuse, and dependence. How are these defined? Well, use is the patient uses the substance occasionally. For example, a patient drinks heavily, but only on weekend, only on Saturday night, right? To go to the bar, have a lot to drink. That's use. Abuse is the patient uses the substance regularly, even though it causes problems in their life. So this is occasional, this is regularly, but it's causing problems. For example, drinking is causing problems in the patient's work life or family life. Dependence, the patient is addicted to the substance and has developed a tolerance. Patient will experience withdrawal symptoms if he or she stops using the substance. And the best example of this is alcoholism. The categories for alcohol, drug, and inhalant use, abuse, and dependence include digits for uncomplicated with intoxication and in remission. So what do these mean? Uncomplicated means there's no indication of the problem other than drug use. No documented intoxication, delirium, withdrawal, anxiety, psychosis, or related condition. So if nothing else is documented, another related condition is documented, we're going to use uncomplicated. The assumption is that if intoxication, delirium, anxiety, psychosis, etc., were present, the physician, being a good documenter, would have documented them. So we're going to assume it's uncomplicated unless there's reason to believe otherwise. With intoxication, patient is drunk or high at the time of the encounter with the provider. In remission, patient no longer uses the drug and is in recovery. These categories also include digits for tolerance and withdrawal. So let's talk about what those means. Tolerance is over time, the body gets used to a medicine or a substance that either more is needed in order to get the high that they're looking for, or they need to change to a different, probably stronger medicine. So their body is tolerant. The same amount of the drug will not get the same high. Withdrawal is when a patient quits using a drug or alcohol, and he or she will experience symptoms such as nausea, vomiting, diarrhea, muscle bone pain, etc. May be used with codes for use, abuse, or dependent. It used to be that withdrawal was assumed to be only with dependence, but they changed the regs in the guidelines a couple years ago, saying that a patient may use or abuse the substance and still go through some kind of withdrawal. Now, alcohol, drug, and inhalant categories, note this does not include nicotine, include digits for delirium, perceptual disturbances, psychotic, delusions, hallucinations, mood disorders, anxiety, sexual dysfunction, sleep disorders, persisting amnesiac disorder, and persisting dementia. So let's define some of these terms. I'm a real stickler for telling me what you're talking about. Define your terms. Psychosis or psychotic disorder is the impairment of the mental state in which the perception of reality has become distorted. So they're not seeing reality as it really is. It might be seeing things, hearing things, paranoia, delusions, change in the personality, disorganized thinking. Hallucinations are hearing or feeling things that aren't really there. Delusions are false beliefs that conflict with reality. Okay, here's some more definitions. Delirium is confused thinking and reduced awareness of the environment. Perceptual disturbance, misinterpretation of the environment, includes hallucinations and an inability to judge the size or direction of something. May include a flashback, including following use of a hallucinogenic drug. Persistent amnesic disorder, lasting disturbance in memory caused by drug use. Persisting dementia, lasting deterioration of mental functions, including impaired speech, movement, sensory capabilities caused by the drug use. So these are persisting, so they last over time. Now, for definitions for nicotine use, as you can imagine, not as much. You're not going to get hallucinations and psychosis from using nicotine. So nicotine category F17 only includes codes for dependence with digits for uncomplicated, in remission, or withdrawal. Now, you are going to get some withdrawal symptoms. I smoked for many years. I went through withdrawal. It was rough, but I made it. So you are going to get withdrawal, but you're not going to get a lot of the other things that you're going to get with other substances. So let's look at some general guidelines for coding for these conditions. So the guidelines say, assign a code for psychoactive substance based on provider documentation. Okay. When the physician or provider has to say, this is abuse, this is dependence. You have to base your documentation on what the provider has written down. You also will use these codes when the substance use meets the definition of a reportable diagnosis. Substance required clinical evaluation, treatment, diagnostic procedures, extends the length of hospital stay, and cause increased nursing care or monitoring. And the provider must have documented the substance use is associated with a mental or behavioral disorder. So all of these must be true before you can use these codes. Okay, unfortunately, sometimes the patient may be abusing or dependent on more than one substance. The guidelines state that codes should be listed for each substance involved. Addiction or use of multiple substances makes things much more complicated, so you want to have documented that they're more than one. Okay, when do you use in remission? We defined in remission earlier as when the patient is no longer using the drug and is in recovery. So use in remission digits only if the provider has documented that the condition is in remission unless otherwise instructed by guidelines or notes. Now, what's interesting is that you have codes for mild substance use disorder in early or sustained, so short or long-term remission. Use a code for substance abuse in remission. If it's moderate or severe substance use disorder in early or sustained remission, use a code for dependence with remission. So this is an important difference. Withdrawal. We define withdrawal as the symptoms that occur when a patient stops using a substance. The guidelines state, when a patient is admitted for withdrawal symptoms, list first the code for withdrawal. That's the reason the patient is being admitted. Now, if the patient is being seen to treat them to prevent withdrawal symptoms, that's not withdrawal. So only if they're actually in withdrawal or admitted for withdrawal. Now, sometimes a provider will document use and abuse or abuse and dependence or all three. So here are the guidelines. If the documentation states both use and abuse, list code for abuse only. If the documentation says abuse and dependence, list a code for dependence only. Both use and dependence, list code for dependence. Use, abuse, and dependence, list code for dependence. So what this is saying is that if they have both documented, list the worst one. If it says use and abuse, code for abuse, because abuse is more serious than use. If it's use and dependence or use, abuse, and dependence, you're going to code for dependence because that's the more serious one. So it's a long way of saying use the one that's most serious only. So only one code. So the guidelines also cover the circumstance when a medical condition is present with use, abuse, or dependence. The medical condition is not coded as a condition induced or caused by the substance use. This is kind of counterintuitive, so this is interesting. For example, alcohol pancreatitis due to alcohol dependence. Now, of course, you're going to do the code for alcohol-induced acute pancreatitis in the K section, but you're also going to do the alcohol dependence is uncomplicated. The guidelines say don't use F10-288, which is alcohol dependence with alcohol-induced disorder. So you're going to use this one as uncomplicated, even though this pancreatitis was caused by the alcohol use. So unspecified is a digit 9, the fourth digit 9 for these. These codes are not used if the documentation says use or abuse. These are only used if it just says alcohol or just says inhalant, but doesn't further define it as abuse or dependence. dependence. It's interesting. One of those autocorrect things, I guess. Okay. Use the fourth digit 9 with all of these categories: F17, F16, F18 to F19. Use only when the substance use is associated with either a substance-related mental disorder, so there's a condition documented due to the substance use, or if there's a medical condition. But remember, if it's abuse or dependence, you're not going to use these codes, the 0.9 codes. So let's give it an example of that, and this will make it somewhat clearer. So the patient is violent due to his drinking, but it's not specified as use, abuse, or dependence. The patient was intoxicated and delirious when seen in the emergency room. So you would use F10921, unspecified alcohol use, and it also code violent behavior, probably the violent behavior first, because that's why they're being admitted. Now notice if it's specified as abuse, you wouldn't use the F10921, you use F10121. If it's specified as dependence, you would code F10.220, not F10.921. So it's only if it doesn't say use or abuse. Okay, so let's start at alcohol. This is F10, and you have use or unspecified F10.9, so what we were just talking about. Abuse is F10.1, dependence is F10.2. So alcohol dependence may be documented as alcoholism. So alcohol dependence equals alcoholism, okay? And here's some of the signs and symptoms of alcoholism, alcohol dependence. So this is a chronic disease characterized by strong compulsion to drink, increased tolerance, which we just talked about, inability to stop when started, and physical dependence and withdrawal symptoms. A note at the beginning of these codes indicates that the blood alcohol level should be coded if known. These codes are in the external cause chapter, category Y90. So if this is documented, you would report it, but it's not necessarily reported by the provider. For example, a police officer might record this at an accident scene. An EMT might document it at the ambulance. A nurse might document it at the hospital. So it doesn't, if you have it, it should be coded, but you can accept a level by someone other than the provider. So these are in the external cause section. Okay, so let's do a practice. If you'd like to do this on your own, pause the video, try to code it, and come back and see what we're talking about here. So alcoholism, patient is drunk at the time he is seen in the emergency room. So I would do F10.229, although I can see an argument for other codes, but we're going to say because it's in the emergency room, we don't know if there's a complication or delirium, so we're just going to use unspecified, okay? The code is F10.229, fifth digit 2 indicates intoxication since the patient was drunk at the time of admission. After the patient is admitted, we will have more information and be able to do abuse, use, dependence, whatever. But right now, all we know is patient is drunk. Now, there's an interesting note. Acute alcohol intoxication may occur in patients who do not have chronic alcoholism. This could be the patient who goes out and gets really, really drunk every weekend, okay, and be seen in a facility with intoxication. That person is a user, but does not have alcoholism. If the patient doesn't have chronic alcoholism, you would do a different code. Okay, so let's move on to drug use, abuse, and dependence. These codes are in 6 different categories since there's so many drugs that may be involved. So you have F11, opioid-related disorders, F12, cannabis-related disorders, F13, sedative, hypnotic or anxiolytic related disorders, F14, cocaine, F15, other, and F16, hallucinogen. So each codes in these categories has digits for uncomplicated, in remission, in withdrawal, with intoxication, and with psychotic disorders. The third digit in the category changes with the type of drug. So you can see here, here, and here. This will change. If it's use or unspecified, it has that fourth digit 9. If it's abuse, it's a fourth digit 1. If it's dependent, it's fourth digit 2. So it will vary. That third digit will vary with the kind of drug being used. Okay, so here's another practice. Patient being treated for withdrawal due to dependence on Valium, a sedative. Sometimes you have to kind of Google to find out what the medication is if you're not familiar with it. This is a sedative. There's no indication of complications due to withdrawal at this time. Okay, if you'd like to do this on your own, pause the video and come back when you're ready. Okay, so this is F13.230. The alphabetic entry is dependence, drug, sedative with withdrawal. The fourth digit, 2, indicates dependence. Here. The fifth digit, 3, indicates withdrawal. The final digit, 0, indicates uncomplicated. So all of this is incorporated into the code. So we're going to say it's uncomplicated. There's no other possible conditions, delirium, perceptual disturbances, other things documented. So this is uncomplicated. Here's another practice. Patient is in remission for dependence on oxycodone and opioid. Patient has not used the drug in 18 months. Pause it if you wish. Okay, the code is F11.21. The alphabetic index entry is dependence, drug, opioid, in remission. The fourth digit, 2, is dependence. Fifth digit, 1, remission. So let's move on to nicotine-related disorders. These are not as complicated because you're not going to have a psychosis or hallucinations because of smoking nicotine anyway. Codes for nicotine dependence on different codes for cigarettes, chewing tobacco, and other substances such as electronic cigarettes. This is category F17. There's also specific codes for dependence that is uncomplicated, in remission, and in withdrawal. Now, there are also codes, and we're going to talk about these more later in the Z code section, history of tobacco use, and then tobacco use without dependence. So this is the one, I've known friends, I don't know how they can do it, who only smoke at parties or only smoke when they're drinking. And they're fine with that. They don't have any trouble with that. Not anybody can do that, but some people can. Okay, so here's another practice. Pause if you wish. The patient is addicted to chewing tobacco, uncomplicated. Patient is currently using the drug. So the code is F17.220. In the alphabetic index, look at dependence, drug, nicotine, chewing tobacco, uncomplicated. The fifth digit, 2, indicates chewing tobacco. The final digit, 0, indicates uncomplicated, meaning not in remission, not in withdrawal. So it's uncomplicated. Okay, finally we come to inhalant disorders. These are in the F18 category. You have use and unspecified, F18.9, abuse, F18.1, dependence, F18.2. There are also codes for abuse or dependence that is uncomplicated, in remission, in withdrawal, with intoxication, and with psychotic disorders. So what are inhalants? Inhalants are chemicals found in ordinary household or workplace products that are inhaled deliberately in order to get high. For example, paint thinner, nail polish remover, gasoline, correction fluid, glue, like airplane glue. So here's a list of those. Easy stuff to get, that's easy in the house, but quite deadly. Okay, here's a final practice. Patient abuses glue. He's exhibiting psychosis with hallucinations as a result. Okay, the code is F18.151. The fourth digit is 1 for abuse. Fifth digit is 5 for psychotic disorder. And the sixth digit is 1 for hallucinations. So we're going to look this up as abuse, drug, inhalant with psychosis, hallucinations. So here are some related codes in other sections. Encounter for blood alcohol and blood drug tests, Z03.83. These are all in the Z code section. Alcohol abuse counseling and surveillance, Z71.5 with additional digits. Tobacco use counseling, Z71.6. Tobacco use, the patient is currently using, Z72.0. Long-term current use of opiate and analgesic, such as methadone maintenance, is Z79.891. You have personal history of nicotine dependence. I got that one, although it's been over 35 years. Family history of alcohol abuse and drug abuse. Unfortunately, there is often a hereditary component with these, so it's important to know if there's a family history. Now note that Z72.0 is used for tobacco use. This is for patients who use tobacco but are not addicted. Z87.891 is used for patients with history of dependence. If you look up history, personal, alcohol dependence, you're referred not to a Z code, but to F10. If you look up history, personal, drug dependence, you're referred to dependence, drug, in remission, codes F11 to F16. If you look up history, substance abuse, NEC, you're referred to F10 to F19. Why is this? Well, this is because dependence is considered to never be really cured and will always be in remission. Tobacco use is different. That will have a Z code, but the alcohol, drug, and inhalant will take you back to the mental health chapter, which is kind of interesting. Sometimes the hardest part of coding is finding the entry in the alphabetic index. Here are some entries for these codes. You can look up abuse, alcoholism, dependence, use. You can also look up alcoholism, alcohol, alcoholic, alcohol-induced. You can look up intoxication. You can look up tobacco. And under each of these, there will be entries for the different types of abuse, dependence, disorder, and use. Now remember that alcoholism is dependence. Okay, now let's move on to the ICD-10-PCS coding for substance abuse treatments. Now these codes are in the ancillary section of your PCS book. They're not in the main part of the book, the surgery section. So we have all of these codes begin with an H for substance abuse treatment. The second character will always be a Z for none. The type of service is a character that will vary. The third digit. The fourth character also will vary, but everything else, 5, 6, 7, is a Z. So these are like placeholders because you have to have 7 digits. So just put in a Z. So in the ancillary section near the back, first character is always H, substance abuse treatment. The second character, the body system, always is a Z. The third character will be the type of substance abuse procedure or service. So you have 2 for detox services, 3 for individual counseling, 4 for group counseling, 5 for individual psychotherapy, 6 for family counseling, 8 for medication management, and 9 for pharmacotherapy. Okay, so what's the difference between medication management and pharmacotherapy? Medication management, character 8, is monitored and adjusted replacement medications for treatment of an addiction. For example, monitoring dosage of methadone used to treat patients dependent on heroin. Is the dosage correct? Is it working? Are there too many side effects, etc.? Pharmacotherapy, character 9, is more long-term. This is to wean the patient from the substance. So for an example, patient receives methadone as part of a long-term methadone maintenance treatment for heroin dependence. So that's kind of if it's just monitoring the dosage, it's an 8. If it's more long-term to wean the patient from the substance, it's pharmacotherapy. So that was the third digits. The fourth digits indicate more information about the type of service being provided. So for third character counseling 3 and 4 and psychotherapy character 5, these will have the fourth characters such as cognitive, behavioral, 12-step, vocational. Okay, this will further clarify what kind of counseling, what kind of psychotherapy. Now for medication management and pharmacotherapy, they use the fourth digits such as nicotine replacement, methadone maintenance, and antabuse. So it further defines the medication being managed or the therapy, pharmacotherapy, type of pharmacotherapy being used. Okay, other types of service, the character 3, list only one option for character 4. So for the type of service, character 3, detoxification, uses only a fourth character Z. The type of service for family counseling uses only fourth character other family counseling. In all other cases, of course, the 5th through 7th digits are Z, none. So most of these are pretty straightforward. You only have to worry about a couple of different characters. For example, detoxification from alcohol and or other drugs, H72ZZZZ. So the only ones that are different are detox, and everything else is the same. For family counseling, the code is HZ63ZZZ. So the only characters that change are these two, family counseling, other family counseling. And the other family counseling is the only option for family counseling. So it's kind of redundant. Rehabilitation is another factor. Rehabilitation, there's no specific codes for this because it can take many forms. It can be counseling, it can be family counseling, group counseling, it can be psychotherapy combined with counseling, pharmacotherapy, detox services. Code for what was actually provided in a specific case. Now you may be saying, hey, wait a minute, there's a whole section on rehabilitation. That's for rehabilitation and audiology. That's a whole different thing. That's physical rehabilitation. That's the patient who is recovering, getting therapy for an injury. So that's not the same as this. Okay, it is impossible to remember all the guidelines for these codes or for any section. So here's some suggestions of notes to make in your book. This is for your ICD-10-CM book. So code the note in the guidelines about coding for documentation, use, abuse, and dependence for the same patient. So just code that, circle that. In the alphabetic index, find history personal and circle the notes about coding for history of drug dependence, alcohol dependence, and substance abuse. In the tabular list of your book, the beginning of the chapter, write in the definition of intoxication and any other definitions that you think you need to remember that you might not remember. So just write them in your book and they'll be right there. And find F10 alcohol-related disorders and circle the note about coding also blood alcohol level. So what about in your PCS book? You might make a note about the difference between medication management and pharmacotherapy. And make a note also about rehab services and code what was actually performed. And don't use the rehabilitation section. Well, this completes the video. If you have questions or comments, please feel free to contact me. If you would like to purchase a copy of the slides for this video, contact me at terry.trobin@gmail.com. If you enjoyed the video, please give it a like or subscribe by clicking on the picture in the lower right-hand corner. Again, here are the books that I have written: E&M coding, CM, PCS. Here's the link to these on Amazon. These are updated every year or as needed. Thank you very much. I hope you enjoyed this video. Thank you.